Assalamu alaikum wa rahmatullah. As a number of COVID-19 cases rapidly increases globally, non-essential businesses have shut down. Governments are forced to close their borders and whole countries are in lockdown. 1.3 billion people are affected by such measures in India alone. The World Health Organization warns that the global spread of this virus is accelerating.
The pandemic is accelerating. It took 67 days from the first reported case to reach the first 100,000 cases. 11 days for the second 100,000 cases. And just 4 days for the third 100,000.
Dr. Tedros goes on to say that asking people to stay at home and other social distancing measures are an important way of slowing down the spread of the virus and buying time. But these are only defensive measures. The World Health Organization has said that there is currently no treatment that has been proven to be effective against COVID-19. Today we look at the practical steps you can implement in your homes and understand the reasons why certain health measures are so important to keeping you safe and healthy. In this program, we'll be speaking to external guests who will be answering your questions, so keep them coming in to us by emailing live@mta.tv or tweet at COVID-19MTAI using the hashtags on your screen. Now, there is a lot of misinformation going around and it's time we stop using WhatsApp groups as our main source of information. We need to get our facts straight. So earlier, we spoke to a leading expert for COVID-19.
For the past few weeks, there has been an overload of coronavirus information, with some governments enacting full lockdowns of their countries to people rushing beaches and parks in rebellious defiance. Now, some of the information floating around is true, but there's so much that's misleading. It's hard to keep track of what's fact and what's just WhatsApp rumors. So to make sense of it all and get our facts right, MTA reached out to an actual expert in microbiology who is working part of an international team to learn more about the infection. Professor Mark Fielder is a medical microbiologist. He's a professor at Kingston University and the president for the Society of Applied Microbiology. His expertise is that he's actually working in relation to the COVID virus with colleagues in America and China, and he's an expert in the infection. So, Professor, experts on WhatsApp have told me that having oranges, eating garlic, taking essential oils and our family's secret traditional medicine can fight this virus. Is that true?
There's been a lot of questions about whether or not things like orange and vitamin C and black seed oil and garlic and various other components can actually help protect you from getting the virus. This, to our current knowledge, is not true. It's all very true that many of these things do have health properties, but they do not help you from getting the virus.
All right then, if you're such an expert, what should we be doing then?
It's very important that we take a lot of steps to protect ourselves and others. The most simple thing you can possibly do is wash your hands. That seems very basic, but it is also very, very important. And washing your hands needs to be done in a very specific way. That should take about 20 seconds to do that, and it needs to be done thoroughly. It means you then cover the whole of your hand. Doing that under hot soapy water means that you then remove as much of the virus as possible and limit the infection, because the way the virus spreads is through what we call droplet infection, and that means droplets of water from your mouth or from your nose can land on a surface, and then you touch it and put it on your mouth, on your nose or on your eyes, and that can infect you. So washing your hands thoroughly really effectively breaks the cycle of infection. People think this is an old, silly thing to do. It really, really isn't. Washing your hands is very, very effective.
If I'm washing my hands so much, how am I supposed to sneeze and cough? I've always been told to cover my mouth with my hands when I cough.
That at the moment is probably not a good idea. If you do have to do that, please make sure you have a tissue which you can cough or sneeze into. You can dispose of that tissue safely and then wash your hands. But most of the time we can't do that easily. So the best way is to cough and sneeze into your crook of your elbow. And you do that by putting your hand up here and coughing into your elbow. That's a very useful way of making sure that we limit the spread of the virus.
Okay, so I wash my hands and I cover my mouth when I cough properly. Surely that is enough, right?
Social distancing is keeping away from other people, limiting your contacts, so making sure you have a contact with no more than 2 people unless they are in your family, making sure you stand at least 2 meters or 6.5 foot apart, and avoiding gatherings of more than 2 people. This is really, really important. And sometimes that's difficult, but it is massively important, because if we limit that, we can stop the infection spreading. At the moment, we understand that one infected person can infect 2.5 other people. But those people going on and infecting more means we infect about 460 people. Cutting that in half means that we actually infect only 15 people. So this social distancing is massively important, and we should avoid social gatherings and also other gatherings such as religious gatherings or going to work unless we absolutely have to make sure that we limit the spread of this virus, save ourselves and also importantly save others.
Well, what about those living in very cold countries or very hot countries? My cousin in Pakistan says there's no virus there.
No, that's not true. If you look around the world at the moment, this virus has been active all throughout Asia. It's active in parts of Africa, and it's active in all parts of Europe. And bearing in mind, one of the big outbreaks in Europe was actually in northern Italy, where people have gone skiing, so it's very cold. So both in hot countries and cold countries, this virus is active. So we can't rely on the fact that a country is hot or cold to make sure that this virus won't infect you.
Well, it all does seem a bit morbid. Is there any hope for the future? And what can I do to combat this virus?
I think we're back to where we started. It's about the social distancing. At the moment, for us as people on the street, we are socially distancing and then keeping away, so we limit the movement of the virus and limit the infection. From a scientific point of view, there's a lot of work being done in trying to find drugs that kill this virus. And there is some work being done with a drug called decimavir, which looks like it might have some promise, and that might have come from work in other viruses like HIV. And there's a lot of work going on in progress to make a vaccine. Unfortunately, that's going to take about another 9 to 12 months before that vaccine is out, because we have to do lots of checks to make sure the vaccine is safe. But in the meantime, we need to follow our government's advice worldwide. We need to make sure that we don't infect people by social distancing and minimising our contact with people.
So these were absolute facts about the virus from an actual expert. Now it's up to us to play our part.
So you've heard what a leading scientist had to say about this pandemic. What's amazing is that 1400 years ago, the Holy Prophet Muhammad sallallahu alaihi wasallam gave us important information which is just as relevant today about how to contain contagious diseases. He said, and I quote, "If you hear of an outbreak of plague in a land, do not enter it. But if the plague outbreaks in a place where you are, do not leave that place." So the Holy Prophet ﷺ is describing the same principles which we today call quarantine and social distancing. Joining us on the phone now is Asif Basit Sahib. Asif Sahib, can you tell us a bit more about what Huzur's instructions are today about this pandemic?
Assalamu alaikum, Dr. Karimullah Sadiq Sahib. Carrying on from where we left last time, Huzur's instruction, we've been, like I said, and I would urge our viewers that they should actually tune into MTA or go to MTA Online 1, which is our YouTube channel, or to MTA.tv on demand, where we have Huzur's instructions playing repeatedly. But in a nutshell, Huzur's instructions, apart from all instructions in terms of precautionary measures, above all, Huzur has instructed us to engage in prayers and supplication. This is a worrying time. This is a very, very challenging time. And the best instruction that we could have is from the Khilafat, from Hazrat Khalifatul Masih, and that has been to pray to Allah the Almighty, our Creator, the omnipotent God, who has all power on everything that happens in the universe. So the topmost and the foremost advice that we've had from Hazrat Amir al-Mu'mineen is to engage in prayers and supplication. Other than that, Huzur has mentioned on various occasions, especially in his Friday sermon, the last one and the one before that, is to observe all precautionary measures that we are being advised to observe by medical experts, and medical expert advice coming especially through our government authorities, whichever country we are living in, respecting them, obeying them, following them, all of it is for our own good and betterment and well-being. Another one thing that must be mentioned here is that there is some advice which is in some countries, especially countries that have gone into lockdown or semi-lockdowns or soft-core lockdowns, if you like, is where they've discouraged or prohibited congregational prayer in mosques. Within the Muslim community or within the Muslim Ummah across the globe, there's been some kind of a very sentimental kind of uproar against that. But the advice that we have from Muslim is to respect what is being told to us by the law of the land, and to bear in mind that it is only for our own good, and whatever we're being told should be followed.
Let's elaborate on this further with our next guest, Dr. Umair Bajwa, who is a trauma surgeon in Germany. Umair Sahib, why should people bother to distance themselves from others?
Assalamu alaikum wa rahmatullahi wa barakatuhu. It is important to keep the distance because the nearer the people are, the higher the risk is that droplets can reach each other and infect the other person. And the way of infecting each other, through inhalation of these droplets, is the most dangerous and the most contagious one.
There are some people who are young and healthy who feel social distancing is not necessary for them. It's only for those who are sick or old. How would you counter that?
This is the big misconception, actually, that the young people think that it is a disease which is focusing at the elderly people. But the thing is that there are studies now, very current studies coming out, that even sportive young patients are also being affected within a couple of hours. And so, and there is just came in a report from this morning that even in California there was a case of a small child who was without even any disease, any known disease before it was affected. The real reasons actually are not clear until now why this is even happening to the younger ones. So therefore it is even more important to emphasize that this keeping the social distance or keeping this distance is for everyone.
So what's this 1.5 to 2 meter zone that most governments are talking about? Is it so no one sneezes on you?
Exactly. For instance, if someone sneezes or someone coughs, then it means that one can assume that for about 30 minutes or even more, these droplets can remain in the air and in a range of up to 6 feet or 8 feet even. And this air, this polluted air, you can say, is the dangerous zone where this inhalation can take place. And therefore, to safeguard yourself, it is the best to have at least this distance of 2 meters.
We can see that social distancing is extremely important. But now watch this graphic. You'll see with your own eyes how important it is. When one person isolates himself, so many people benefit. And that then has an effect throughout the whole community. If you watch the graphic, you'll see that self-isolation as an individual affects whole communities, which then affects whole countries. Just by one person self-isolating or not meeting the other, it has a counter effect on the whole globe in effect. And this can then help to prevent the spread of this virus. Now, many of you would have been seeing your governments repeatedly urging you to wash your hands. Some of you may be dismissive of this advice, as you always wash your hands. But washing your hands isn't just a matter of rubbing your hands under a running tap and singing happy birthday to yourself twice. Let's see the right technique.
Washing your hands is more important than ever. And according to the World Health Organization, this is the best way to wash your hands. Once you've wet your hands with water, you should apply enough soap to cover all hand surfaces. In this example, our black gloves represent dirty hands, so let's apply soap. First, you would rub the hands palm to palm. Next, with the right palm over the left hand, with interlaced fingers, we'll rub together the backs of the hands. And you can see the edges of the fingers are not properly covered. So to clean the backs of the fingers, we rub them with opposing palms with the fingers interlocked. Next, the thumbs need a bit more attention, so with rotational rubbing of the left thumb clasped in the right palm and vice versa, we're able to rub the thumbs. Next, with rotational rubbing, backwards and forwards with clasped fingers of the right hand in the left palm, we can scrub in all the final details. We just need to make sure that we cover the wrists area, and that's the last part that needs our attention. Once the wrists are properly cleaned, we now have nice clean hands.
So just to reiterate, although in this graphic you saw that the person was wearing gloves, you need to take your gloves off, and it needs to be done with soap and water. The reason for the black gloves was it's a visual demonstration to yourselves as to how effectively the soap and water needs to go across your hands. Now, Dr. Tanveer Ahmed Saab is a medical emergency doctor practicing in both the United States and Canada. He joins us from Detroit now. Assalamu alaikum, Tanveer Sahib. Can you please tell us why washing your hands with soap and water is so important, and what does the soap actually do to this virus?
Wa alaikum salam. The important thing, there are two folds. Number one, this virus actually, I'm sure most people have seen what the virus looks like. It is sort of a spear with spikes coming up. Right underneath is a layer of lipids, which the ordinary people will call fat. Once you start washing this with water and soap, what it does, it actually effectively washes away the fatty layer. And once that layer washes away, the virus has no way to attach itself to the human epithelium, the human nasal passages, and thereby essentially becomes ineffective to infect the individual it is sitting on. And that's why it's crucial. And once you wash the hands, it's also important that you don't touch your face, don't touch your nose, just as a general measure.
We're receiving many emails and messages through Instagram and questions. Let's kindly address some of these questions. The first question is, does steam help with preventing coronavirus?
It does not. As a matter of fact, it can potentially harm you because steam at high temperature can actually burn the upper nasal passages and even can go down into your throat and whatnot. It absolutely offers you no protection. If anything, it can cause more harm than good.
Next question, Asim Sab from the UK asks, is coronavirus spread in the air? And if so, for how long?
The coronavirus, like other respiratory viruses, when somebody coughs and sneezes, it forms a small particle we call droplet, and it can float in the air for 3 to 6 feet. And that's why the emphasis is that people should keep a distance of 3 to 6 feet. Depending on the study, I've reviewed some, it can float between 30 minutes to a few hours. But for most general people, it begins to settle down within about 30 minutes or so. And then it gets dispersed, depending on the surface it lands on. But for most ordinary people, that's where the social distancing, that's where the close contact with the individual matters so much that we ask people to stay away from potentially sick people, stay away from each other when the other person is coughing and sneezing.
Jazakallah Tanveer Saab. So with that, we conclude today's program. The message is clear and simple. Maintain good self-hygiene and keep a safe distance. With the power of prayers and sticking to these basic principles, inshallah we'll see this through. Please keep safe and keep others safe. Continue to send your questions to our experts, and we will inshallah hope to join you again soon on our next broadcast on Sunday. With that, we conclude today's program and hope and pray that you and your loved ones are blessed with Allah's divine protection. Until then, Assalamu alaikum.